helping us in advising our patients to look after certain benign conditions, benign in the sense that if, for example, we come across a patient who is overweight and has got a fatty liver, and there is a strong family history of diabetes, but this patient has not yet developed diabetes but has got an enlarged fatty liver, we can always advise him to look after his intake, to look after his weight, etc. So there are other conditions like silent gallstones lying in the gallbladder, and these patients quite frequently develop referred pain in the epigastrium, which they consider to be gastric in origin, etc. So, patients who present to us with clinical conditions, they are not our focus here. Our focus is for this screening examination, those patients who are otherwise absolutely healthy without any complaint. So, we have divided the body into different segments like face and neck, the chest, pericardial region, and axilla, the abdomen, in which we include the abdominal wall, the abdominal viscera, retroperitoneum, pelvic organs. We will also see the peripheral vessels, the carotid vessels, any atheromatous changes, if we can find any abnormal varices, saphenofemoral junction, its competency, etc. The hernial orifices, inguinal orifices, etc. We also will see the flow in different arterial vessels peripherally, like, for example, the radial artery, the dorsalis pedis and posterior tibial arteries, etc. So, all these findings we will make a list of those organs which we have to see in a book or a copy in which we will enter the findings of that patient. And this patient will come for a follow-up, preferably after every 2 years, or maybe after a year, if a patient is, say, more than 40 years of age. So today we are going to demonstrate it to you. How are we going to start the examination? We have a patient here. So for male patients, it's okay if they don't have anything put on. But for ladies, we would like to have a special gown, sleeveless gown, which is open from front, because we will be examining uh, the breast tissue in these patients. We would prefer that for ladies, there will be a female chaperone, and the light of the room should be very dim. For males, it is more convenient for us regarding seeing them with an open gown, a sleeveless gown. So I'm going to start with the face, the parotid, submandibular glands, the jugular digastric lymph node, the muscle, etc., the supraclavicular region, the suprasternal region, thyroid gland, the blood vessels, carotids, and the vertebral arteries, using a linear probe, and in thick-necked individuals, for the vertebral, we can also use a convex probe. So there will be application of different linear and convex probes in different regions, which I'm going to show you today. So today we are going to start with a linear probe. You can see my probe. Its footprint is, as you can see, I have measured it for you, 3.8 centimeters. It's a small probe which can be easily fit. We can fit it easily in the neck region. It is good to have a small pillow beneath the chest of the patient, so the neck will become a little extended and probe movement will be easier. I'm going to show you where I'm going to put the pillow. उठ के बैठे वो वाले लेट जाए. हाँ, अब उधर. You can see now there is some space beneath the neck. The neck is extended a little. ये मास्क उतार लें जरा. ठीक है, उधर देखना. So first we will be going through the right side. Then we will ask the patient to see towards the right, and we'll go through the left side. So I'm going to place the probe here. And you can see this spongy you can see this spongy right parotid gland. Here you can see some preauricular lymph nodes. There we are. It is good to put some color if you have seen a lymph node which is spherical or rugby ball shaped. So this is a cyst, and is it a cyst or a lymph node? To me, it appears as a cyst because there is some posterior enhancement, but sometimes a caseated lymph node also will appear like this. So you see, we have started the examination and we have seen two findings. He is an absolutely healthy individual, an athlete. You can see the masseter muscle fibers there. So there we are. We have seen the right parotid gland. Here again you can see some lymph nodes. And they are looking caseated. I'll put some color here to see if there is any flow inside. I have reduced the velocity, the pulse repetition to see if we can detect the presence of any flow inside, but no, I couldn't. Okay. After seeing the cystic, well, we can always go for a fine needle aspiration to know the nature of the material inside. Now I'm on the sternocleidomastoid muscle now at the angle, and also I can see the jugulo-digastric lymph node below the angle of the mandible. There we are, the jugulo-digastric. There is some flow in its hilum. It has an intact hilum, and there you see some flow. All right. So jugulo-digastric lymph node we have seen. And now going for the retroauricular region, there are some small multiple lymph nodes. There we are. We can appreciate the transverse processes of the cervical vertebrae here. There we are. After looking upon the parotid, we'll apply some more jelly here and we'll go for the submandibular gland. This is it, the submandibular gland. There we are. The submandibular gland. Also, you can see some lymph nodes here. And now, after looking upon the submandibular gland,